Good evening, Ripley County. I'm Dr. Dave Welsh. I'm your Ripley County Health Officer. There's a lot going on. There's a lot of information going fast and furious. There's updates multiple times a day from multiple sources. The governor, the president, the CDC, the State Department of Health. This meeting tonight was in an effort to try to get information out in a timely fashion. We actually had invited stakeholders to join us here, but with the new limits on how many people can be in one room at one time, we did not want to violate that, so our option was to set up a video to cover some of the commonly asked questions, to update folks, and I'd like to thank the City of Batesville for helping expedite and arrange for this filming. If you have questions that didn't get answered tonight, contact the Health Department. You can go to the Health Department website and post questions, and you will get answers very quickly. So first, I want to remind everybody, let's do the things to keep us out of trouble. Remember what our mom said: wash your hands, stay away. If you're sick, stay away from folks who are sick. Give them a 6-10-foot berth and give them wide berth around that. If someone coughs or sneezes and they have this virus, it can linger in the air for hours. So if you're out someplace, when you get home, wash your hands. When you're home at the end of the day, after you've been doing whatever you have to do, launder your clothes. The good news is regular laundering of clothes will clear the virus. Washing hands is very important, and it's actually better than the hand sanitizer. I know people are complaining they can't get the hand sanitizer. Although I did learn today that a company in Indianapolis is converting what they're normally doing to produce a hand sanitizer to try to fill in the void out there. So where do we stand? Currently there's 56 people in the state of Indiana that are confirmed coronavirus positive. There have been 2 deaths. 380 people have been tested. There was an update today by Dr. Box, Indiana State Department of Health, as well as our governor. That transcript and video is available on the Ripley County Health Department website. If you have questions after that, please pose the questions. So some facts to be considered. Who's at risk? So if you're in close contact, you're at risk. You're at higher risk if you have over the age of 60 and immunocompromised or other medical conditions such as hypertension, diabetes, COPD, chronic renal failure, or coronary artery disease. If someone is exposed and they're put in quarantine, if they complete the quarantine, are they safe to be around? The answer is yes. Are the different ethnic groups at higher risk for this condition? The answer is no. So if you see someone of Asian descent, you don't have to avoid them unless they're symptomatic. What are the symptoms you want to watch for? Fever, cough, shortness of breath. If you get these symptoms, you want to seek medical attention, but not show up at the hospital, not show up at urgent care, not show up at the doctor's office. Call first. The hospital initiated a new and innovative program this afternoon. Many of you may be familiar with the telehealth option for kids at the schools that they initiated this past year. The kids are not at the school, the staff is not at the school. They initiated a program at the Batesville Elementary School this afternoon. Part of the process is screening folks so they can be screened with respiratory illness there and then decide, do they need to go to the hospital, do they need to go home with treatment? But you don't go there, you call first. You can go to the hospital website and there's information how you access that situation. Now, if you're really sick, do you want to go through all that? If you're really sick, you're having chest pain, you're having what you think is appendicitis, you're having, you think you're having a heart attack or pneumonia, you call 911. You do what you would normally do. But I would ask you, if you're going to call 911, whether it's for law enforcement or EMS or fire, and if you are in quarantine, if you are having severe respiratory symptoms, please let the dispatcher know so that our first responders can stay safe and keep you safe and keep others they're in contact with safe. They have equipment to help them mitigate if you happen to be sick with respiratory or, heaven forbid, the COVID-19. We do not have an unlimited supply of first responders. We've got great first responders, but we have to protect them so they're ready and can stay online and help you, your family, your neighbors, and friends. Today, there was a lot of reassurance from our governor. The schools are going to be out through May 1st. He's going to extend the public health citing that he did a couple weeks ago. So things are still ongoing. You don't have to worry about a lot of things. If you have to go to the BMV for car license, there's not going to be any late fees during this crisis. If you have questions what you can and can't do, there's numbers to call. If you want to call the State Department of Health to know what you might have to do in a circumstances, they have a 24-hour helpline that will help you with a lot of your questions. There were a lot of questions raised online. Some of it had to do with, I haven't received information. How do I get on the list? If you've not received information, or if your group or organization wants to be, have me go out to you or the health department, contact us. We will get you on the list. There was one, shelters, food banks. We've been talking to schools regularly. The schools have been doing a great job. We've talked to the gyms. We've talked to the churches and the ministers. As you may know, there's not dining in at any of the restaurants, but there's still carryout. The county offices are closed to the public, but still open for business. Osgood city offices are closed to the public, but open for business, and they encourage you to use the drive-through. The hospital is reaching out to the community. They are setting up the telehealth, as I mentioned. They are they're doing things to make sure that the public and the community is as best served as possible. There is a lot of talk about personal protective equipment, gowns, masks, gloves. I was very happy to inform the public that the Ripley County Health Department distributed over 2,200 N95 masks to our first responders. If you are in manufacturing, if you're in construction and you have some PPE equipment that you would like to donate to healthcare, I would encourage you to do so and contact your local healthcare entities to see how you can help. By the way, the city of Osgood has already offered to help by contributing some PPE equipment to the healthcare providers. The N95s are designated for healthcare entities or others. As of today, the president and the vice president lifted restrictions on the N95, so if they were designated for any use, they can be used by healthcare. So that has changed. And they're ramping up production of the PPE equipment, particularly the masks. If you're not getting information or you're looking to get information, you can go to the website at the hospital, but you can also go to the website at the Ripley County Health Department. We have on there information from the CDC, Indiana State Department of Health, from the AMA, from the American College of Surgeons. We have a means for you to sign up to get updates yourself directly from the CDC. There's a breakdown of information if you're wanting to know what can I do in my home, what can I do at work, what do healthcare folks need to be doing. That's all available and in-depth on the CDC. There's even a section on frequently asked questions. And I would encourage you to look at that. It was asked about the testing kits. There is an increase in availability of testing kits, both from the federal government and their sources, but they've also opened it up to other entities like Roche, LabCorp, Quest. I understand as of today, I learned that Eli Lilly was working on their own test that'd be quicker and accurate. All these tests, whether it's the state, through the State Department of Health, or these other labs I mentioned, are all going to be double checked at the CDC. So that's, you may have heard presumptive infected. Those are folks that the test shows positive. Those test samples are then sent to the CDC for confirmation. If you think that you've been exposed, if there's somebody who's diagnosed or been traveling away and they have respiratory symptoms, you may want to quarantine yourself or be evaluated. If you have symptoms and you've been exposed to somebody with the COVID or suspected COVID-19, you need to seek attention, medical attention, and stay away from others until you're in the clear. Are there questions in the room? We do have a few people in the room. I was asked a question about restrictions at Margaret Mary Hospital that actually has been changing in the last 24 to 48 hours. So they're restricting traffic. There are a few situations where one person would be allowed in, such as in labor and delivery, a minor child, and I would encourage you to go to the Margaret Mary Health website to get the most up-to-date restrictions. It's not against you or anybody else. This is to protect you and the public while we try to get a handle on this serious public health crisis. I would also want to extend an ask for folks who can, if they're able to. Earlier today, because of all the commotion surrounding the Corona-19 virus, people are staying away from blood donation centers. And it's gotten to a critical level at different parts of the country. Surgeon General Jerome Adams today, when he had the press conference with the president and the vice president, asked for people who are able and can safely do so to donate blood when possible, because that is another way to save lives. Even though elective surgeries have been canceled, that's how serious this is, people still need blood. There are still emergency surgeries. There's still accident victims that need care, that need to be addressed. So if you're able, if your health is such and you're not a high-risk individual, I would encourage you to consider donating blood. And you can check with Hawksworth or your local hospital what opportunities are available where you can donate blood. I was asked what sources of information are timely and reliable, since there's so much going on out there and some of it's accurate, some of it's not. Locally, I would recommend Ripley County Health Department website. It's updated frequently throughout the day, and we utilize trusted and verifiable sources for the information we put there. If there's a question you have that you don't see or readily available, ask it in the chat box and we will get it for you. Other reliable sources would be the CDC. You can actually ask to get regular updates from them if you have an email account. I would also recommend locally Margaret Mary Health's website. It is also timely, verified, accurate, and updated frequently throughout the day. You can also go to the Indiana State Department of Health. There is also a resource page on COVID-19 at the AMA. You don't have to be a member to access that information.
Do you want to say?
I was also asked if the links that we have available through the health department would be available associated with this message that's being sent out. The answer is yes. Additional links for some of the information available on our website will also be available through the email that this video is being sent out on. I've also been asked who needs to wear a mask. The person who needs to wear the mask is the one who's symptomatic. If you're not symptomatic, you don't need the mask. I would refer you to a number of presentations by Dr. Jerome Adams, our Surgeon General, on this subject. If you're symptomatic, if you're having respiratory symptoms and you're going somewhere, you have to get out to get your groceries, you have to take care of pets or a neighbor, that's the people that need to be wearing a mask. If you're asymptomatic, you do not need the mask. I was asked if there's going to be future updates after this one. The answer is yes. It'll be done as frequently as needed. If you or others desire more frequent than we're going, please let us know, and we'd be more than happy to accommodate.